many of us here today have put off going to the doctor when we're sick? Let me guess. If you have a headache, you know you can use a pain reliever. It's just time consuming. I just wait and see. The doctor didn't believe me. This is what some of you said to us when we asked you about your experience with the Canadian healthcare system. Hi, my name's Renata, and I'm one of the product managers for HiHenrietta, an app designed to put healthcare at your fingertips and support doctors and patients. Let's face it, the Canadian healthcare system is broken, and we face a monumental crisis where unnecessary deaths and long wait times are a reality for those of us who reside here. Now, our physician shortages mean that 8 million people in Canada, which includes some of you on the call right now, are currently without family doctors, leading to clogged walk-in clinics and emergency rooms and poorer health outcomes. And how people are navigating it today, search engines, loved ones, medical books, walk-in clinics, and ER times, what they're lacking is urgency, accuracy, and even empathy at times. Which is why we've built a better solution that helps Black people self-diagnose sooner, empowering them to act by managing their conditions at home, and then only going to the doctor for pressing needs, reducing the strain on walk-in clinics and the ER system. So why now? Well, statistics show that you're 30% more likely to be misdiagnosed if you're Black or a woman. And the longest waiting walk-in clinic times in Canada are around 3 hours. And delays to medical necessary care can actually cost you almost $3,000 out of pocket. At HiHenrietta, we feel that we can do something better for someone like Jane, a Black professional who, like many of us, hates long walk-in times and won't necessarily take the steps to get care unless it's absolutely necessary. Siona is going to show you how we solve Jane's problems using the solution our developers coded with a LEMP stack. Take it away, Siona.
Thank you so much, Renata. So Jane has found our product via a Google search. She is registered, and now she's going to start the symptom analysis. The first thing she's going to do is let the app know that she has a really bad headache. Then she's going to let the app know that she's had these symptoms for less than 48 hours. She's not sure what side the headache is on. She knows it gets worse when she bends forward. The intensity is pretty severe. She doesn't have other symptoms. Her pupils are the same size as one another. She hasn't become less alert, and she's not having difficulty moving any of her limbs. She'll reaffirm that she's had these symptoms for less than 48 hours. And because of the input she provided, HiHenrietta will recommend that she seek medical attention right away. From there, Jane will end the assessment and let us know that this was helpful. From there, she can go back to home. In a future state, HiHenrietta would support Jane to connect with medical professionals. So now she's back on the home screen. She will hit settings so that she can log out and to secure her private information. It is now the next day. Jane has checked her email and found a message from HiHenrietta. Like a good friend, HiHenrietta has checked in to see how Jane is doing. Jane will select the call to action to provide us with an update in the app. She will log in, submit her two-factor verification code for security purposes, verify her account, and here is the prompt to provide us with an update. She will go ahead and submit that update, let us know that her symptom analysis was accurate and that this was confirmed by a medical professional. She's feeling better today. Her symptoms have improved and that she did seek medical care. She'll go ahead and hit submit. And now she has some time to check out her personalized health recommendations. The first one will catch her eye. She'll take a look and explore, but then she'll realize that she's actually read this information before. So she'll go to the kebab menu and let us know that so that she can enjoy the rest of her personalized health recommendations. And so that concludes our demo presentation. I will now pass it back to Renata. Thank you very much.
Thanks, Siona. Now let's talk about our secret sauce. While health chatbots aren't a novel concept, we do have 5 key differentiators, including our focus on Black people, community partnerships, and medical record integration. And our mission-driven team is 100% diverse and has personal stake. Initial feedback has been positive, with users highlighting benefits such as health advocacy and going deeper than Dr. Google. And better yet, we have 38 people with skin in the game who've been waiting for us to launch our beta app. We hope to build on this momentum through driving awareness with social media engagement and campaigns in the pre-launch stage. And then we're going to be aggressive with digital campaigns in our launch phase and encourage testimonials to build social proof post-launch. Now let's talk about the numbers. The health chatbot industry is set to balloon to 1.35 billion within the next decade, and we're eyeing an $8.4 million slice of that pie. So how do we make money anyhow? When Jane realizes the value of our app, she then starts paying $10 a month to pay for the premium package, which would provide her with deeper health insights. Advertisers pay for sponsored content and articles every time. And physicians pay each time we provide Jane with in-app referral with a 10% referral fee. Now, we project that we'll break even by year 2, thanks in part to our revenue streams, which should scale with our user base. Our research shows that the chatbot industry is projected to grow at about 18% per annum, and we feel confident in our assumption given that 75% of the people we shared our waitlist with signed up. Now, we've learned 3 key things along the way. Waiting costs your health and your finances. People want us to handle their data with care, and personalized tips will help us, our candidates, self-advocate. Now, we're currently in the development stage of our product lifecycle, and we aim to acquire physician advisors before we launch the beta app for testing. Also on our roadmap is importing medical data, looking to partner with apps such as MyChart and diversifying our revenue streams. Now, who's ready to join the movement to redefine healthcare for Black people? Please scan the QR code now to join our waitlist. We are HiHenrietta, and thank you for listening to us. We'll now take your questions.
All right, let's give them a round of applause, please. Let them know how you felt about their work in the chat. Let's give them some energy and some love. Thank you to the HiHenrietta team. All right, we'll leave the QR code on for a bit if you guys want to scan and join your waitlist for their personalized AI health chatbot. We'll start with Eileen Hickson for feedback, and we'll go to Dakwa, and then we'll end with Ali.
Thank you. Thank you. Great presentation. Obviously, I'm in the healthcare space, so it's appealing to my vanity and my domain expertise as well. But honestly, the healthcare space is also really difficult to address, right? Because a lot of people who have not had experience in healthcare still realize it's a problem, and everyone's trying to solve this. So I think, scale is going to be definitely challenging. But as you think about your ecosystem and, you've put a lot of thought into data security, which is always one of the questions. But how have you thought about keeping the information relevant and getting professionals like doctors or healthcare professionals to be able to contribute to the information that is being generated and stored within the back end of your application to make sure we're giving the most update and most relevant, because I think that's definitely a challenge.
And thank you for asking that question. One of the things that we've actually budgeted for is making sure that we have at least one on-staff doctor who will be an advisor and make sure that that information is relevant. We know just based on our research that Ada Health, which is one of the largest apps with the self-diagnosis space, they actually have 60 doctors worldwide on staff. So we'd have to look at scaling once we get bigger. So right now, tackling that with one doctor.
Awesome. And just a secondary question, when it comes to competing, right? I think everyone wants to solve the healthcare industry. So competition, I would say, is soft in a way because no one wants to outbid someone else that's trying to help healthcare because everybody needs it right now. But how are you going to participate in an ecosystem where the market continues to grow?
I think that's a great question. So something that we found is that there are different ways of tackling this problem. So right now, there are hospitals in Canada that are actually using AI technology to prioritize healthcare. So for example, we know that the ER waiting rooms are swamped. So they're actually trying to figure out who they need to see in the next 2 hours. If our app can be a trusted resource, maybe we can help our people get to the front of the line because they've already done the triage. They don't need to see the triage nurse, or they can see the triage nurse and validated. So I think that's something that could set us apart. The other thing that Buoy Health is doing right now is they're actually partnering with employers. So for example, New York Times, what they're doing is, because in the States, and the States is one of the markets we're looking at, they have to pay for health insurance. And the challenge with that, of course, is it can be really expensive. So if it's something that you can actually manage at home, you're able to divert to the lower expense and lower expense thing. So it actually keeps insurance rates down. So I think there's a lot of ways that we can monetize and make ourselves competitive, especially since we're focusing specifically on the Black segment.
Yeah, no, I love that. And I love that you're thinking about how your app pertains to the journey of the patient from your app to the hospital triage system. I think that is a very encompassing and very compelling viability, but also journey. So great job, team. Really awesome.
Thank you, Eileen Hickson, for your feedback. Let's go to Duckle.
Okay. Thanks for the presentation. Great presentation, and it touches home because I've actually launched a telemedicine business in Nigeria. We've actually grew it to about 1 million users. So I fully understand your problem. So I have a couple of questions speaking from experience. So first one would be, I love it. It looks like it's focused on primary care, if I'm correct. But it seems like the user journey isn't complete, right? And what I mean by that is, I know when there's an emergency, you advise them to seek medical care. But it would have been nice to see you guys being able to help them find that second stage of being able to speak to that medical care. So my question to you would be, what do you see as the potential growth opportunities for your service or your product?
So while we showed you the here, go to the doctor flow today, we actually have a separate flow that shows you, here you have a migraine, go lie down, take medication and so on. But for today, we wanted to show this particular view. So I think in terms of future state, it's going to be important to, in terms of our advertising, we're going to communicate to people the flow that actually shows the value of the advice. So that's one part of it. The other part, I think, is the personalized advice. So 44% of the respondents that we spoke to said that they are desperate for personalized health tips. So, you're at home, you are trying to figure out how to take care of yourself. Our app is going to do that because it's learning about you over time. Our testing found that people actually want to share their private information with us. When we gave them the option to skip, they were like, no. We actually want to populate that because the app is getting to know about me and is giving me better insight. And so we're going to do better than Google. So I think that's what's one part that's important, as well as partnering with Black doctors. Something that we're hoping to do as our next stage is actually partnering with an organization like the Black Health Care Professional Network, so that we can start to really make a difference.
Awesome.
All right, thank you for your response. Thank you for your question. Let's go to Ali Farhat.
Yeah, great application. I built so many of those in the past, and I have so many questions, but time is limited. So I'm gonna ask away at a couple of key questions. I agree with Depo. The user journey isn't complete. The problem that you presented is about doctor shortages, but the application didn't really offer anything to solve that problem. So I think there's a gap there, and something is missing. I want to also touch about medical records, medical data, HIPAA compliance, how that is a big pain point for any business if not handled correctly. But what concerns me the most is your diagnosis system. How do you put that together? How is it validated? Is it giving the right advice? When we're talking about patients and we're talking about medical histories, for example, I don't know, I'm just going to shoot an example out there. If the AI is giving a recommendation for them to take an off-shelf medication that they could have allergies for. So there's some legal and some medical practice research that you'll have to do there. What it feels to me is that even if the journey drops off, so for example, let's say you do have a patient, they're onboarded on the application, they do have the chat, they do get the recommendation, how do you keep users coming back to the application? Personalized recommendations are not always the best way, in my opinion. Check-ins are great only if there's a condition that they have shared with you, they want to check in with them later. But between that and between the other visit could be many, many months. So I just want to hear some ideas that you guys have about keeping users engaged, because it feels like there's a gap. If I am onboarded today and I share that I have a medical condition, great, you know, the medical condition was fixed the next day. How do you keep me coming back?
Okay, so I think you touched on a few different things. You
Yes,
talked
I did. Yeah.
about, yeah, so HIPAA compliance is something that we talked about. We did the research ourselves, but realistically, we're going to have to get, this is where the partnerships piece is going to be important before we can even consider a beta launch. So realistically, we're going to have to get legal in our corner. So that's step one in how we deal with that. And beyond HIPAA, there's also, I think, PHIPA in Canada. So those are two different things that we've thought about. The other thing is, how did we put it together? So right now we put it together with ChatGPT. The thing about ChatGPT is right now it's better in terms of statistically, ChatGPT and even Google's medical AI, it's doing as good or even better than doctors. But we're not trying to replace doctors at all. This is why we're going to make sure we have doctors who are partnering with us to make sure that that information is accurate and up to date. So we're not saying we're replacing doctors, but what we're trying to do is if there is something that's simple enough to handle at home, then in theory, you're not going to the walk-in clinics, and hopefully that will cut down on wait times. We're not telling people to use a specific medication. We're saying to you, use the pain medication. So then we're not saying use Tylenol, and it turns out that you have an allergy to that. So I think that kind of takes care of it. Of course, we're going to have extensive terms and conditions to take care of that piece. Coming back to the app, one of the things that is in development right now is daily mood check-ins. So something that we want to do is mental health is like really important to the Black community. Our research found that essentially we're sort of being left behind in that regard. So they're not catching it fast enough. So that's one of the reasons why mental health check-ins is so important to our app. So basically there'd be a daily mood input. So people are coming back and then they're tracking their journey. This is a really important market for us because right now the mobile health app market is about $32 billion because people are so invested in their health. So there are people who are like you who aren't going to be coming to the app unless you've got something serious. But then there are actually people who are more health conscious. That's why Apple, the Fitbit, Apple Watch, all of that stuff, like people are spending like $1,000 on wearables, whereas we're charging nothing for free. People Google their symptoms every day. So I think that's something that we're thinking about. So I would say the way that we're keeping the users engaged is the mood check-ins.
Have you ever thought about concentrating in a specific area? Like medical is so big, right? We talked about mood check-ins.
Yeah.
We talked about personalized recommendation. Did you ever guys think about just pivoting a little bit or changing your model just a little bit, that your focus, for example, on pregnancy or newborns?
Yes.
Or diabetes, for example, management? And that could be your entrance or your gate to that market, because the market you're currently targeting seems so large. There's so much misinformation in that market. People are the worst self-diagnosers, by the way. They always assume that they have the worst disease in the world, right? When you diagnose yourself.
Yes.
So, yeah. So have you ever thought about taking it that way?
So it's funny that you mentioned that. I'm hoping, okay, so I'm actually just gonna, Mo, you're gonna have to forgive me, but I have to share this with you. I'm glad that you asked that, because one of the things that we did was we asked people to rate app features, and Tracker for my child's health and Tracker for pregnancy actually came in just below the condition-specific support appointment scheduling. So it's a really great idea, and you've given us something to think about, because the data supports that. So we'll take that away. Thank you so much.